This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello and welcome to continuing COVID-19 coverage on the Your Health podcast. I'm your host, Shaun McMahon. On this episode, we're going to dive deeper into what has become one of, if not the focal point of the entire pandemic, our elderly. From the challenging situations in long-term care facilities to the increased risks for that particular age group, the geriatric population doesn't have it easy, and there are so many other layers to consider. Layers that are sometimes pretty difficult to discuss, but that's why we're here. On this episode of Your Health, I'm joined by two very special guests who are dealing with two very important topics: mistreatment and mental health. On the line, Sarita Israel, social worker and coordinator in the area of expertise to counter the mistreatment of older adults within CREGÉS, the Center for Research and Expertise in Social Gerontology within CS West Central Montreal. Sarita, thanks so much for being here.
Thank you.
Also joined by Senior Psychiatry Resident Dr. Alexandre Allard, who's part of an exciting new volunteer program that's helping that very vulnerable population with their mental health. Dr. Allard, thanks for joining us.
My pleasure to be here.
So, Sarita, if we can maybe just begin with you, because the mistreatment of the elderly is a delicate issue, of course, and one that we probably don't know nearly enough about. So I'm hoping you can shed some light on it. What's the main issue that, in your line of work that you tend to face, and maybe how has it been exacerbated in the face of COVID-19? Because so many seniors are facing incredibly difficult moments of isolation right now.
Okay, so I think one of the key issues is a better understanding of mistreatment. Mistreatment actually occurs in a situation where, in a relationship where the people know each other. It's family situations predominantly, or someone that is close to the older adult. So already we're on, and that's kind of the small environment. What the sanitary crisis has done right now, it has imposed isolation on the elderly predominantly. And what this does is it takes a situation that may have been pre-existing and aggravates it when the people that live together don't get along. And even before, if the things were doing okay, in a situation where now they cannot reach out to people that normally would be available to help them or give them respite, they're more confined and there's more opportunities for a situation that was not existent to develop. I would like to share with you a little bit of what some of the risk factors for someone to be in a situation of mistreatment in the first place.
Absolutely.
Situation, for example, if they already have a bad physical health, if they're depressed, if they don't have revenue, if they have cognitive impairment. And one of the things, I think this is one of the key issues, sometimes when people themselves, the person that gets mistreated has a hostile personality and behaviors, or is too passive, because it creates reactions from the people they live with. From the perspective of the relationship, one of the major issues is to live with the person that mistreats you, and to see it as family violence, or to already have conflicts interpersonally. And that also gets aggravated when you have to help the person and there's tension in the help relationships. You take a person that needs to give help and you have someone who resists it. And rest of times it's not easy, but if you already have a bad relationship, this could lead to something a little bit more, more severe in terms of actions. I want to make a very valuable point. People who mistreat don't always have bad intentions, but I'm happy to say the majority of people are not badly intentioned. So that's why we need to be able to give them the information, the help, the support, in order for the mistreatment not to happen. So it's more resolvable.
Right. And I want to come back to the resources in just a second, but if we can turn things over to you, Dr. Allard, because one of the overlooked issues of this COVID-19 pandemic is the mental health crisis amongst vulnerable older adults. As we said, social distancing has led to increased isolation, and that just exacerbates the anxiety and the depression. And you're part of this great new telehealth intervention program for isolated older adults, and I want to know what your role is. How does it work? Who's getting called? Who's doing the calling? I have so many questions.
Yeah, sure. Well, listen, basically it's called the TIPOA, which is the telehealth intervention program for older adults. And it's an initiative based out of the Jewish General Hospital by Dr. CREGÉS. And it's basically setting up a large network of volunteers from pretty much everywhere. And we're calling people, mostly from our CIUS, who are older adults, who, for whatever reason, during this pandemic have symptoms, sort of distress or feeling overly isolated or being depressed or sad, or even without any specific diagnosis tied to them, people who are struggling. And what we do is that we have these volunteers once a week for a minimum commitment of on our volunteers' part for 3 months. It'll always be the same person. We call them for 1 hour about every week. And all we do is it's a friendly conversation. It's a friendly conversation. There's some support involved. And we also do check-ins. We do check-ins with, are you eating enough? Are you taking your medication? If so, why not? Are you feeling okay? Are you able to do the activities? And we have all this network also built up so that if there's a red flag, we sort of have paths that we can shuffle them down. So we have, names of resources, how to access those resources and things like that. So my role on this team, I'm part of the core clinician group. And basically, there are many different people from many different professions that are working on this: social workers, occupational therapists, residents like myself, doctors, researchers. So that I think would be the basic thing.
Okay. And when you hear Sarita talk about mistreatment, is that the kind of thing that a volunteer, would potentially be listening for signs for on one of these phone calls?
Exactly. Absolutely. And one of the big things, and I was thinking about this, if you used to be, in a difficult situation with, I don't know, your son-in-law, you could choose not to see them very much. But now if you're stuck in the same home, then you don't have that choice anymore. Hopefully people, with time, and that's why we have a 3-month commitment, feel comfortable, find a way in which to communicate to us that there's a problem.
And develop a bit of a relationship in essence, right?
Well, that's exactly the point, right? Developing a relationship that's obviously voluntary. People, it's a voluntary whether they want to receive the phone calls or not. And so with that, we hope to maybe get this catchment area, maybe get these people that wouldn't otherwise be talking or wouldn't have an outlet to talk, It's an extra choice in a time where our choices have been pretty limited.
And I'm glad you brought that up, because just before I turn things back over to Sarita, telehealth everywhere within our CEOs has been huge during COVID-19. Do you get the sense that this is something that we might continue to see the benefits of post-pandemic, and maybe something that will continue beyond this?
Well, absolutely. If you look at right now, what we're doing is we're building infrastructure, and we're finding out ways, and that's part of the research project. We're finding out how we can do this well. And if this works well, it's no stranger to us that older adults in general are more isolated. So even past pandemic, addressing these very deep social concerns of elder isolation is very important. I think whatever we learn by doing what we're doing now is going to increase our knowledge in the future as well.
Well, that's great stuff. And just a reminder, by the way, that the annual Mind Strong event in support of mental health is coming up on June 13th, so right around the corner. Obviously, a bit of a different feel this year. It's going to be a virtual house party, which is a super great idea. And this volunteer telehealth program for older adults is one of the initiatives that it's raising money for, along with extra capacity for telepsychiatry services and innovative care for dementia and Alzheimer's. You can get all the details. Check it out at jghfmindstrong.com. Just before we wrap things up, Sarita, let me turn it back to you, and let's talk about resources. Where can people go if they're looking for more info, if they need some more help?
Okay, so first of all, there is a dedicated line, provincial line. It's called the Lean Line, Elder Mistreatment and Helpline, LINAWNE. And that's the line that's been, put up by the ministry on their action plan to counter mistreatment. And it's available, 7 days a week from 8 a.m. to 8 p.m. And that line, what's interesting about it, it can answer questions to the public, but also for professionals in terms of, what they can do and other resources they can go for. And also, when we look at people in a situation of imposed caregiving, there's La Ligne Info Aidant, which is also a line that can help directly in terms of issues related to caregiving and how to have strategies to cope in a caregiving situation.
Okay, fantastic. We'll get those numbers up, by the way, in the description of this podcast in case anybody's looking for them and might need them. Dr. Allard, last word to you. Anything you want to add?
I just want to say, if anybody wants to join the initiative, we do have a contact email. So it's telehealthmontreal@gmail.com. And just so you know, we're taking referrals from any physician that is concerned for their patient and wants to get them having phone calls within our CEUs can send us an email there at telehealthmontreal@gmail.com. And if anybody wants to participate, anybody's free to participate. We have them. We'll have an interview with you. We'll train you through the JGH volunteer program in order to do this. So again, contact us. Anybody can contact us if they want to either refer a patient if they're a physician or participate. And then very soon in the next few weeks, people will actually be able on our website to self-refer. So we're working on that right now.
Fantastic stuff. More proof of the community coming together when it really, really counts. Thanks so much to you both. Sarita Israel, social worker and coordinator in the area of expertise to counter the mistreatment of older adults within CREGÉS, the Center for Research and Expertise in Social Gerontology within our CIUS West Central Montreal, and to Dr. Alexandre Allard, senior psychiatry resident at the Jewish General Hospital. Much appreciated. Best of luck to you both going forward. Thanks for taking the time on the Your Health podcast.
Thank you, Shaun.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at ciuswestcentral.ca/podcast or on your favorite podcast platform.